is baby Jacob, and I'm feeling the bones in the back of his head. It's called his occiput, or the base of his skull. He's 6 weeks old, and he was first adjusted when he was 3 weeks old. The first time we put him on the table, he would not turn his head to the right, and when I turned it to the right, he would turn it back to the left. And now, when we turn it to the right, he stays there comfortably. So we've been adjusting his head and his neck, and originally he would not nurse on the side. Bless you, bless you, bless you forever. Originally he wouldn't nurse on the right side with having to turn his head. And so now after his first adjustment, he's been nursing better. And it's really important for babies to be able to nurse on both sides, because it helps to balance the hemispheres of their brain and the right and left side coordination in their body and their eye coordination with their nervous system. So when I adjust babies, newborns, we're using craniosacral therapy with very, very little. It's about 5 grams of pressure. It's enough to
Put it in. There you go.
Very, very gently move the vertebrae and take the pressure off the nerves. Take the pressure off of the membranes that cover the brain and the spinal cord. So I'm on his C3 vertebrae on the upper part of his neck on the right side. It's not moving as well compared to the other vertebrae in his spine, so we're just going there and holding. Tiny amount of force and pressure on it. We're allowing it to start moving better. So I'm taking my fingers and just gradually inducing some motion right there in the joint in his neck. And we can see he's easily able to turn his head all the way to the right now. So there are cranial nerves that come off of the brain and go through the base of the skull, down the front of the cervical spine, into the stomach. So when the bones in the head aren't moving properly, it can affect the digestion and the stomach and the spitting up. So it's good while we're adjusting. It's a good thing to adjust his head for that reason, to help with his spitting up, and also the thoracic spine, because the nerves come directly from the thoracic spine and go to the stomach. Okay. Good job, Jake. You're well done. Okay, so look at that. When he first was here 3 weeks ago, he wouldn't turn his head to the right. And now he's laying there, he's going to fall asleep with his head to the right.